I'm Sheila Hemphill with Texas Right to Know. It is a privilege to bring together experts from Italy who have actively been utilizing ozone in several hospitals, and Dr. Robert Rowen, who utilized ozone during the Ebola outbreak in 2014. Dr. Rowen, thank you for joining us.
Thank you. What I want to bring to this group is that there is a form of ozone that can be done. It's probably the oldest form of ozone, which is direct intravenous gas. It costs maybe $1 in materials to administer it. The treatment can be done in 3 minutes. It can be done several times a day if needed. And my own personal belief, and that of Dr. Robbins, is that it will be as effective as most any other form of ozone for this. It is so simple to do, so inexpensive. It can be done anywhere in the world, even third world countries. And we went to Sierra Leone in 2014, and we were able to get the 5 cases of Ebola. And all 5 cases responded virtually immediately as soon as ozone was administered. They had no further deterioration and recovered with no sequela. And we published this.
Okay, Dr. Rowen, I will defer to our Italian medical translator from Italian to English, PhD Geraldine Picotte.
Okay.
So, Dr. Rowen, I know after having several conversations with various different individuals that the concern, would you please clarify the concern of embolism from the confusion of air versus ozone and the effects potential in regards to tightening of chest and possibly a cough and some heart rapid is what I'm also being told, as well as some vein irritation. If you would please speak on each and pause and allow for a translation.
Veins can get irritated, that is for sure. And if you rotate veins and administer it slowly at lower concentration, you can reduce the irritation. If there is a central venous line, there is no issue.
Is that for a PICC line as well? PICC line or straight port?
No problem. PICC line, no problem. Any central line, no problem to veins.
Vorremmo la nostra pratica.
They're using a lot more doctors and people that are doing this.
Ecco, quindi si potrebbero essere.
They can maybe do more errors because they're not all equally skilled.
Semplice perché può essere.
Yeah, they're not allowed to in Italy to use direct injection, and so that's why they do it their way.
Okay. I have no issue with that. Their way is fine. It works. It's considered the standard. I am tossing this out as a means to get to more people more quickly in a state of emergency.
What we had discussed was the potential of this direct therapy being available to people who are symptomatic rather than exacerbated already in hospitals.
Let me finish with what you asked to begin with, and then I'm going to have to go.
Okay.
This is oxygen gas. It is not nitrogen. The risk of embolism is virtually zero. Oxygen is absorbed very quickly, and this has been intravenous oxygen gas has been published for years in Europe.
Minuti, un quarto d'ora si riesce in.
They're probably more set up to in terms of distribution of this, of the way they do it.
Of course, I know that.
What about the tightness of the chest, cough, and rapid heart rate?
All right. Tightness of the chest can happen, and cough. They're basically synonymous, and it goes away in 5 to 10 minutes. Rapid heart rate, I haven't had any issues with that. And if it happens, it goes away very quickly. It might be associated with a little bit of tightness in the chest, but it's not significant.
And how many of these procedures have you personally done?
I've done probably a few thousand overall. Dr. Robbins has done 300,000.
They feel that there's a risk of an embolism.
I can't help that. Howard has done over 300,000 cases. He's actually been investigated by the government, and if there was an issue, he'd be out of business.
Dr. Rowen, please tell your website where they can find more information about you, please.
My website is Dr. Rowen, DrRowen.DRSU.com.
Dr. Rowen, thank you for your time that you have shared so generously with me over these several weeks as we have been trying to communicate this through our legislative and state agencies. And on here is Representative Bill Zedler, who sits on the Public Health Committee. Representative Zedler?
I'm right here.
Okay.
And what I would like to hear is from the Italian doctors, the comparison between those who received the ozone treatment and those that did not, and the period of time, or that would be the big thing, is
Okay.
the comparison as well as any of this published.
Dr. Franzini, we are going to ask, when did you receive permission and from whom did you start this procedure for COVID-19?
Esattamente il 25 marzo.
The 25th of March was the date they got the okay.
From whom?
E oggi abbiamo
From
pubblicato.
Dal ISS, no? Ha dato il permesso. The
E oggi
ISS. And they've published today the first 11 cases that they've treated in the first 2 hospitals that started this.
What are the outcomes of that
posso
publication?
mandare il report che abbiamo fatto.
He will send the report that they made of these results.
Out of the 11 patients, were these very serious patients?
Invece erano 5 intubati, vero?
5
5
were
intubati
intubated. Some were on a
e
respirator. They
un
took the tubes out on
paziente
2 of them,
How quickly?
the 4th or 5th day.
4.
1 on 4, 1 out of 4.
Days? Repeat,
Aspettiamo
recap that,
giorni.
please.
Basically, from what I understood, it seems like 1 out of 4, they could take the tube out after a couple of days, 4 days.
How many procedures? How many passes of infusions?
1 time a day. They did 1 time a day, 1 pass.
Wow.
And in 4 days, they were able to remove the
The tube,
tube?
1
Right.
patient. They had some
Perché
miraculous
hanno avuto
improvements.
tutti.
Within 1 or 2 days, they all lost the fever.
È
Oh, the protein was reduced in
un'infiammazione.
the blood tests. The heartbeat
Quindi,
reduced, became normal.
We will do a presentation on this report once it is received by Texas Right to Know. We will then follow up on that report. Were there any contraindications of patients who received the therapy?
no, l'abbiamo fatto anche a
They even did
ma
it to a person that was so bad, they were only able to do 2 times because he had passed away. They divided among all the groups doing it, they divided the patients into 5 groups. From individuals who barely had a fever and maybe were just starting to have trouble to breathe,
certo,
to
il
people
primo
that were
dato
intubated and in bad shape. From
nel
putting all this
respiratorio,
together, that the earlier you treat the person, the better result you have.
Was this technique permitted by changes of your laws or by internal to the hospital's ethics committees?
He's answering really a
senza
different
grandi
question. He said
permessi,
the ideal patient, what they would like to do, and it's probably difficult for them to get this mobilized, is to get patients that are just positive and give them the treatment before they get sick, before they come to the hospital, but they're
Sono
tested as
sicuramente
positive. But they get, within 8 days, they're fine.
più
And they
controllo.
become negative.
Is this technique available to all hospitals in Italy or specific to ones who've approved it through their ethics committee?
Yes, it's by hospital authorization of the ethics committee.
Non
But
ha
the
messo
Institute, the ISS
limitazioni.
was not against it. Yes, it's at the level of the ethics committee of each hospital.
I would like to turn it over to anyone that has a medical or scientific question.
Quasi tutti questi pazienti
Almost all
hanno
these patients,
dire
improvement of hypoxemia
questo
in
e
a short
anche
period that stabilizes the breathing.
Ah, sì.
And the creatine becomes normalized, which is important for the function of the kidneys.
Let me ask
Yes,
one
sir.
other question. They had mentioned about being published, and could we get a copy of like something in print as to what they've done and the results and that kind of thing?
Yes, they made a report for the ISS.
E allora
In
diventa un
15
pochino-
days, they'll have from the hospitals 30 or 40 cases, and they'll do this formal report. They have a preliminary report now.
Can we get the preliminary report?
Yes, I will make sure that we
Wonderful.
have a copy of the report, and giving availability of Dr. Luigi perhaps, or Dr. Franzini, we might do another translation specific, a video specifically on that report. And I also need, please, from the Italy, the protocols that were used with detail of CC and ozone methods.
He
E che
wants to
sono
underline that there's
migliorati
that
in solo
improved
5 giorni, 5
in
days.
5 days.
Sono
And they
date.
get the treatment 1 time a day.
Domani
Wow, that's
mattina
great.
He'll send the documents even if they're in Italian tomorrow morning, because he has to leave the studio. You know, they have curfew there.
E vi
Yes.
mando
Right.
il
That's
tipo
what I
di
was worried about.
And the
apparecchiature.
protocol and the machines that they're using. He said they feel that success at using the ozone therapy depends also on the equipment that's used. They use very long tubing, like 60 to 65 centimeters. A transformer that weighs like 25 kilos. The machine is a big machine.
Quindi è riuscito.
And it's a machine that allows them to give the exact amount of ozone that's used. Okay, he'll find what he has in English and he'll send that, but if not, he'll send the Italian.
Thank
Va
you
bene.
all. Thank
Bene.
you so much for all your attendance.
Grazie a
Prima lo
voi.
prendi e meglio è, chiaramente.
This is Sheila Hemphill with Texas Right to Know. It has been a privilege to bring forth experts from Italy, that has been so hard hit by the COVID-19, to have good news of potential therapy to aid in this crisis that we are in. Visit texasrightoknow.com. Please communicate with your legislators. We are so much going on that this information that I've been trying to get to our governor, our Department of State Health Services, our medical board, I'm going to need everyone's help to try to get this information to them so that we in the United States would have access to this therapy in hopes of being able to resolve the situation. I want to thank everyone in attendance. I just ask for God's blessing upon our nations as we combat this in a unified approach to bring health and wellness back to our world. So God bless you all.